Welcome to Health Systems of North Carolina PHSNC Staff Training Series, protecting clients, honoring rights, and providing culturally responsive care. Part 2, Client Rights, helping you live your dreams every day. Welcome, and thank you for being here. My name is Dolores, and I will be your guide through Part 2 of the PHSNC Staff Training Series. In this part of our training, we focus on something that is at the very heart of everything we do at Health Systems of North Carolina: client rights. At PHSNC, we believe that every individual we serve has inherent worth and dignity. Our mission is to provide person-centered, compassionate, and clinically sound behavioral health services that empower individuals and families to achieve stability, independence, recovery, and meaningful quality of life. Our vision is to build stronger families and healthier communities by meeting individuals where they are, helping them overcome systemic barriers, trauma, and unmet needs, and supporting long-term recovery, self-determination, and sustainable success. Understanding and upholding client rights is not simply a legal requirement. It is a reflection of our values and our commitment to every person we serve. Helping you live your dreams every day. Learning objectives for Part 2. By the end of this training, you will be able to identify the key rights guaranteed to every client served by PHSNC, explain informed consent and what it means in practice, describe the client's right to refuse treatment and how staff should respond, articulate the right to dignity, respect, and privacy in service delivery, outline the PHSNC grievance and appeals process, and connect client rights principles to PHSNC's mission, vision, and person-centered values. These objectives apply to all PHSNC staff, including peer support specialists, qualified professionals, clinicians, administrative staff, supervisors, and organizational leadership. Section 1, the foundation of client rights. Client rights are the legal, ethical, and organizational protections that every individual is entitled to when receiving behavioral health services. These rights are grounded in federal and state law, as well as PHSNC's own policies and values. Federal protections include the Americans with Disabilities Act, Section 504 of the Rehabilitation Act, the Mental Health Pact for America Act, and Medicaid regulations. In North Carolina, additional protections are outlined in General Statute Chapter 122C, which governs the rights of individuals receiving mental health, developmental disabilities, and substance use disorder services. PHSNC takes these rights seriously, not just because the law requires it, but because our values demand it. When we uphold client rights, we are honoring the personhood of every individual we serve. We are saying, you matter, your choices matter, and your voice matters. As PHSNC staff, you have both a legal obligation and a moral responsibility to know, protect, and advocate for these rights every single day. Think about what brings most of us to this work. We are here because we believe in people. We believe in recovery. We believe in possibility. Client rights are the framework that supports all of that. Section 2, the right to informed consent. Informed consent is one of the most fundamental rights in behavioral health care. It means that before any service, treatment, or intervention begins, the client must be given clear, honest, understandable information about what will happen and must agree to proceed. For consent to be truly informed, several conditions must be met. The client must have the capacity to understand the information. The information must be presented in plain language or through an interpreter if needed. The client must be told the nature and purpose of the service. They must understand the risks and benefits. They must know about alternative options, and they must be told they have the right to refuse. At PHSNC, we use consent forms that are specific to the services being authorized. But signing a form is only the beginning. Staff must ensure the client truly understands what they are agreeing to. If a client does not understand English fluently, we are obligated to provide interpreter services or translated documents. If a client has a cognitive or communication challenge, we adapt our approach accordingly. Consent is not a one-time event. It is an ongoing conversation. Clients can withdraw consent at any time, and staff must honor that decision without punitive consequences. Key term: informed consent means agreement given voluntarily by a person with decision-making capacity after receiving complete and accurate information. At PHSNC, we treat consent as an act of respect, not just compliance. Section 3, the right to refuse treatment. One of the most misunderstood client rights is the right to refuse treatment. Many staff feel uncomfortable when a client declines a recommended service. But it is essential that we understand refusal is a legal right, and our job is not to override it. Under North Carolina General Statute 122C and federal Medicaid guidelines, individuals receiving behavioral health services have the right to refuse any treatment, medication, or intervention unless a court has ordered treatment or the individual is in an emergency situation that presents imminent risk. When a client refuses treatment, your role as staff is to document the refusal accurately, ensure the client understood the nature of what they were declining, provide any safety information that may be relevant, notify your supervisor according to PHSNC policy, and continue to maintain a respectful, non-coercive relationship with the client. You must never threaten, pressure, manipulate, or penalize a client for refusing services. Doing so is a violation of their rights and may constitute abuse or neglect under state law. Fictional scenario for reflection. A PHSNC peer support specialist is working with a client who has been referred for medication-assisted treatment. The client says, "I appreciate everything, but I'm not ready to try medication right now. I want to try recovery differently." What would you do? Pause here and consider, how do you respond in a way that honors the client's autonomy while ensuring their safety and documenting appropriately? The correct approach is to acknowledge the client's decision without judgment, provide education about available options, document the conversation and refusal, and inform your supervisor. Continuing to respect and engage the client is essential. Section 4, the right to dignity, respect, and privacy. Every person served by PHSNC has an absolute right to be treated with dignity, respect, and compassion. This right is not conditional on behavior, diagnosis, history, or compliance with a treatment plan. Dignity in behavioral health services means using preferred names and pronouns, speaking to clients in a respectful, non-condescending tone, not discussing clients in shared spaces where others may overhear, avoiding language that labels or demeans, such as using the word addict, crazy, or non-compliant, maintaining privacy in physical spaces, such as closing doors during sensitive conversations, and ensuring that documentation reflects the person, not just their symptoms or diagnoses. Key term: dignity means recognizing and affirming the fundamental worth of every human being, regardless of background, behavior, or circumstance. At PHSNC, we use person-first language. We say person with a substance use disorder, not addict. We say person experiencing a mental health crisis, not a mental patient. Language shapes perception, and the words we choose in clinical documentation, team meetings, and daily conversations matter. Privacy is another dimension of dignity. Clients have the right to expect that their health information will not be shared unnecessarily, that staff will not discuss their cases in elevators, break rooms, or other non-secure settings, and that their records will be handled with the utmost care. Fictional example. During a team meeting, a staff member casually mentions the name of a client and describes details of their mental health history in front of colleagues who are not involved in that person's care. Is this acceptable? No. This is a potential HIPAA violation, a breach of the client's right to privacy, and a violation of PHSNC policy. Always apply the minimum necessary standard, which we discussed in Part 1, and ensure conversations about clients take place in secure, appropriate settings. Section 5, the right to participate in your own care. Every client served by PHSNC has the right to be an active participant in their own treatment planning, goal setting, and service decisions. This is the foundation of person-centered care. Person-centered care means that the client, not the clinician, is at the center of decision-making. It means that services are built around the individual's goals, strengths, preferences, and cultural context, not around what the provider thinks is best. Key term: person-centered care is an approach that places the individual at the center of all service planning and delivery, prioritizing their goals, values, and self-determination. In practice, this means inviting clients to share their goals before writing a treatment plan, not after. It means asking open-ended questions. what does recovery look like for you? What would be different in your life if things were going well? What strengths do you bring to your recovery? At PHSNC, we understand that self-determination is not a luxury. It is a clinical standard and a human right. When clients have a voice in their care, outcomes improve, engagement increases, trust builds. Documentation must reflect the client's voice. If you write goals for a client without their input, you are not practicing person-centered care. The Individual Service Plan, or ISP, must genuinely reflect the client's stated goals and priorities, written in language they can understand. As a PHSNC staff member, ask yourself, am I planning with this person or for this person? The answer to that question shapes everything. Section 6, Advanced Directives and Psychiatric Advance Instructions. Clients have the right to plan for their own care in advance, including in the event that they experience a mental health crisis and are temporarily unable to make decisions for themselves. A psychiatric advance instruction, also known as a PAI, is a legal document in which an individual specifies their treatment preferences, names a healthcare agent, and identifies what they do and do not want to happen if they experience a crisis. In North Carolina, psychiatric advance instructions are authorized under General Statute 122C71 through 122C77. As PHSNC staff, it is important that you know whether your clients have an advance directive or a psychiatric advance instruction on file. If a client has expressed interest in creating one, connect them with your supervisor or the appropriate clinician. This is an act of person-centered, rights-respecting care. General advance directives, including healthcare power of attorney, may also apply to behavioral health decisions. Always follow PHSNC policy and consult your supervisor when questions arise about how to honor an advance directive in practice. Key term, psychiatric advance instruction is a legal document allowing individuals to specify their mental health treatment preferences in advance of a crisis while they have decision-making capacity. PHSNC is committed to supporting clients in exercising self-determination even in moments of vulnerability. Helping clients plan for their future is one of the most powerful ways we can say, we see you, we respect you, and we trust you to know what you need. Section 7, the Grievance and Appeals Process. Clients have the right to file a grievance when they believe their rights have been violated, when they are dissatisfied with the services they received, or when they believe a PHSNC staff member has acted inappropriately. PHSNC maintains a formal grievance and appeals process that is accessible to all clients, regardless of their ability to communicate in English, their cognitive capacity, or the nature of their complaint. No client should ever be discouraged, penalized, or retaliated against for filing a grievance. As staff, you must know how the grievance process works, where forms are located, and how to assist a client in accessing the process if they request help. You must never interfere with a client's ability to file a grievance. You must document all relevant information accurately and promptly. If a client tells you they want to complain about something, even if that complaint is about you, your responsibility is to take that seriously, remain professional, listen without defensiveness, and connect them with the appropriate process. Grievances are also an opportunity for PHSNC to improve. They tell us where gaps exist. They help us grow. When a client trusts us enough to tell us something went wrong, that is valuable feedback that makes us better. Key term, a grievance is a formal complaint filed by a client or their representative regarding services, staff conduct, or a perceived rights violation. Key term, an appeal is a formal request to review or overturn a service authorization decision, denial, or reduction. Always follow current PHSNC policy and your supervisor's guidance when a grievance or appeal arises. Timely, accurate documentation is essential. Section 8, Client Rights in Documentation. Documentation is one of the most powerful tools we have in behavioral health services. It communicates what happened, what was decided, and what needs to happen next. And because documentation is a legal record, it must always reflect the truth, protect the client's rights, and adhere to PHSNC standards. Client rights in documentation include the right to review their own records with limited exceptions, the right to request corrections to their records, the right to know how their information is being used, the right to restrict certain disclosures, and the right to be documented about with dignity and accuracy. When writing notes, assessments, or treatment plans, PHSNC staff must use objective, professional language that reflects the client's story, not the staff member's judgment. Avoid language like client is manipulative, non-compliant, difficult, or drug-seeking. These terms are stigmatizing, legally risky, and clinically inaccurate. Instead, document observable behaviors. Client did not attend 3 scheduled appointments and stated they were experiencing transportation barriers. Or, client declined medication option, stating personal preference for non-pharmacological approaches. Document what you see, hear, and what the client says, not what you assume or feel about them. The individual service plan must reflect the client's actual goals, written in their words where possible, and reviewed and signed by the client as a partner in care. Remember, documentation follows the client. It travels with them. It can help or harm their access to future services. Every entry you make is an act that shapes a person's story. Make it one they would recognize as their own. Section 9, Scenario-Based Reflection and What Would You Do? Let us take a moment to pause and reflect. The following scenarios are fictional and are designed to help you apply what you have learned. Scenario 1. A client arrives for their intake appointment. The front desk staff begins reading through the client's prior records in an open waiting room while asking the client to verify their information aloud. Other people in the waiting room can hear. What would you do? Think about the client's right to privacy, to confidentiality, and to dignity. What steps could have been taken differently? How should this be handled going forward? Scenario 2. A case manager is frustrated with a client who has missed several appointments. In a team huddle, the case manager says, "I'm just going to close this case. This person clearly doesn't want help." What would you do? Consider the client's right to continued services, to be treated without judgment, and to have barriers to engagement addressed. What should this staff member do instead? Who should be involved? Scenario 3. A client signs a release of information form, but later calls and says they have changed their mind and do not want their information shared with the person listed on the form. What would you do? Remember, clients have the right to revoke a release of information at any time. The staff should immediately document the revocation, stop any pending disclosures, and follow PHSNC policy and applicable law. Scenario 4. A new staff member hears another team member referring to a client by a diagnosis in a casual conversation. "Oh, that bipolar client on my caseload." What would you do? This is a violation of person-first language, dignity standards, and potentially of confidentiality. How would you address this with your colleague? Who else might need to be informed? Take a few moments to reflect on these scenarios with your team or supervisor. There are no perfect answers, but these situations represent the kinds of decisions you will face in this work. Grounding yourself in PHSNC values and client rights will always guide you in the right direction. Section 10, Key Compliance Reminders for Client Rights. As we wrap up the content portion of Part 2, here are your key compliance reminders. 1. Every client must receive a copy of their rights at intake and upon request. Ensure they understand what is in the document, not just that they received it. 2. Consent must be voluntary, informed, and documented. Never assume consent. Never pressure a client to sign. 3. Document refusals clearly, accurately, and without judgment. Always notify your supervisor per PHSNC policy. 4. Use person-first, dignifying language in all documentation, communication, and interactions. 5. Never discourage, interfere with, or retaliate against a client who files a grievance. 6. Clients have the right to participate in treatment planning. Document their goals in their words. 7. If a client has a psychiatric advance instruction, know where it is and how to honor it. 8. Violations of client rights must be reported. You are a mandated reporter and a rights protector. Those two roles go hand in hand. Always follow PHSNC policy, supervisor guidance, applicable law, payer requirements, and documentation standards. Section 11, Knowledge Check. Before we close, here are 5 knowledge check questions for facilitator use. Discuss these with your team or reflect on them individually. Question 1. A client refuses to take their prescribed medication. What are the staff's responsibilities in this situation? Question 2. What is informed consent, and what are the 3 conditions that must be present for consent to be valid? Question 3. A staff member overhears another employee discussing a client's diagnosis in the break room with a colleague who is not on the client's care team. What should the staff member do? Question 4. What is a psychiatric advance instruction, and what is the staff's responsibility when a client has one on file? Question 5. A client tells you they want to file a grievance about how they were treated during their last appointment. What are your next steps? Take time to discuss these questions with your supervisor or training facilitator. The goal is not just to know the right answer, but to understand how to apply it in real situations. Closing, client rights as a reflection of PHSNC's mission. We have covered a great deal of ground today, from the legal framework of client rights to informed consent to the right to refuse, to dignity, person-centered care, advance directives, grievance processes, and documentation standards. But I want to close with something that goes deeper than policy. At PHSNC, we believe that every person who walks through our doors, every person who calls our line, every person who receives services in their community deserves to be treated as a whole human being. Not a diagnosis, not a case number, a person. Our mission is to empower individuals and families to achieve stability, independence, recovery, and meaningful quality of life. That mission only becomes real when we honor the rights of the people we serve every single day, in every interaction, in every document we write, in every decision we make. Our vision is to build stronger families and healthier communities. That vision depends on trust. And trust is built when clients know their rights will be protected, their voices will be heard, and their dignity will be honored. To every member of the PHSNC team, thank you for the work you do. You are not just a service provider, you are a rights protector. You are a beacon of hope. You are part of someone's story of recovery, helping you live your dreams every day. Thank you for completing Part 2 of the PHSNC Staff Training Series. Please proceed to Part 3, Cultural Competency and Respectful Service Delivery.